Go ahead, Manjula.
Hi, good morning, everyone. Good afternoon. My name is Manjula Narasimhan. I'm from the Department of Reproductive Health and Research at the World Health Organization in Geneva, Switzerland. Before I start my presentation, I just wanted to note that the guideline and the executive summary in both English and Portuguese have been uploaded into the handout section, which is located in your control panel on the right-hand side of your screen. Please feel free to download this and share this widely. I also wanted to inform you that we will hold a webinar in French for Francophone African countries, and the executive summary will also be available in French by September. Next slide, please. In this webinar, we'll be sharing some of the key elements of the 2017 WHO Consolidated Guideline on Sexual and Reproductive Health and Rights of Women Living with HIV. The purpose of this webinar is to provide an overview of the WHO Guideline development and the unique process of meaningful community engagement used in this development. We'll also be providing an overview of the process of some of the new recommendations, and we very much look forward to feedback from national and regional stakeholders regarding how best to further disseminate and implement this guideline, and also what implementation tools would be the most appropriate in your context. Next slide, please. So this guideline was published in February 2017, and it's really the outcome of a broad consultative process involving national, regional, and global experts. We had healthcare providers and policymakers, program managers, colleagues from several UN agencies, Ministries of Health and National AIDS Control Programs, and also people living with HIV. And I really wish to thank in advance the panelists, who are all key experts in this guideline development, as well as the many, many experts who have contributed to this document. My thanks also to Adis May from the Implementing Best Practices Initiative, who has kindly agreed to manage the logistics for this webinar, and my many thanks to colleagues from the World Health Organization's Regional Office for Africa, with whom we are co-hosting this webinar. We will have all the presentations and then we'll respond to questions at the end. However, during the presentations, feel free to type any questions that you may have in the question box, which is again on the right-hand side of your screen. We have 102 registered participants from 25 countries, and in case we do not have time during the webinar to answer any questions, we will respond to them after the call. Please also note that we'll be sharing the recording of the webinar with everyone and also posting it online. Okay, next slide, please. So, the rationale and the scope of this guideline is because in many countries, women living with HIV do not have equitable access to good quality health services, and they're also faced with multiple and intersecting forms of stigma and discrimination. Women living with HIV are also disproportionately vulnerable to violence and violations of their sexual and reproductive rights. This guideline starts from the point when women already know they are living with HIV, and women living with HIV who are not aware of their status must first be reached by safe, voluntary, non-coercive HIV testing and counseling. In addition, although this guideline focuses on women living with HIV, it is acknowledged that sexual and reproductive health issues are in many cases similar for all women. Next slide, please. Firstly, I just wanted to quickly show this to highlight, what a WHO guideline is. It's a document which contains WHO recommendations about health interventions, whether they be clinical, public health, or policy interventions. And what WHO means when we use the term recommendation is information about what policymakers, healthcare providers, or patients should do. And it really implies a choice between different interventions that have an impact on health, but they also have ramifications for the use of resources. There really is a rigorous process which is followed, including looking for what evidence is available and the methodology of how recommendations are developed. And this is described in the GRC handbook, which is shown on the slide and available online. Next slide, please. This guideline consciously adopts the perspectives of women, their families, and communities. It is grounded in and advocates for a strengthened, comprehensive, woman-centered approach to sexual and reproductive health and rights. And a woman-centered approach, by that we mean an approach that sees women as active participants in, as well as beneficiaries of trusted health systems that respond to their needs, their rights, their preferences in humane and holistic ways. It emphasizes the promotion of gender equality as central to the achievement of sexual and reproductive health and rights. It requires that women are empowered through education and support to make and enact decisions in all aspects of their lives, including in relation to sexuality and reproduction. It's an approach that recognizes the strength of women as active agents and not merely passive recipients of health services. And it's also an approach that is organized around the health needs and priorities of the women themselves, rather than an HIV disease management and control. Next slide, please. So there are a few other key aspects of this guideline that I just wanted to highlight here. Unique to the development of this process is a global community survey that was conducted by and for women living with HIV to assess the sexual and reproductive health priorities. And this was really done so that to ensure that the values and preferences of the women living with HIV could be placed at the heart of the guideline. And you will hear more about this unique process of meaningful community engagement from the next speaker. And I wanted to note here that this guideline is intended to address women living with HIV in all their diversity. And also that the guideline captures this diversity across across the age groups, emphasizing that that we need interventions from adolescence to postmenopausal years. Next slide, please. And the framework that was developed for this guideline therefore places these key principles of a woman-centered approach, gender equality, and human rights at the center of the document. And in addition, it places value to both health interventions and safe and supporting enabling environment. You see in blue the health interventions and in purple the enabling environment. In both are important because it is recognized that while policies and programs and interventions to improve the sexual and reproductive health and rights of women living with HIV exist in some places, these alone will not bring about improved health outcomes in the absence of safe and supporting enabling environment. Next, okay. So this consolidated guideline seeks to bring together both new and existing recommendations and good practice statements into one document. And where current WHO guidance applies to all women, including women living with HIV, this particular guideline will refer readers to those other publications for further information. And the following 3 slides will show a brief overview of new recommendations that were identified for this guideline. Further details on each of these recommendations and these topics can be found in the department's website and from short videos that will be available when we post this webinar. Next slide, please. So firstly, evidence shows that experience or fear of violence is a barrier to HIV disclosure, accessing treatment, and care services. And building on systematic reviews, 2 new recommendations were issued in this guideline with regards to safe disclosure of HIV status to women who fear or are experiencing violence. And policymakers and service providers should recognize that many considering HIV disclosure either fear or are experiencing or are at risk of intimate partner violence, and interventions for these should include discussions about the challenges of their situation, potential risk of violence, and actions to disclose more safely, and also facilitate links to available violence prevention and care services. These recommendations build on previous guidelines and guidance from WHO, and with regards to, particularly with regards to healthcare providers' roles and responsibilities and their training in how to ask about violence, offer first-line support, and the attitudes of healthcare providers as well. We are now following up with a manual for health managers and a training curriculum, both for in-service and pre-service training for healthcare providers. There will be a specific section for family planning providers to support women experiencing violence with safety in choosing methods, but also for another module for HIV providers to support women experiencing violence with safety in relation to HIV disclosure. Next slide, please. Another recommendation is around the issue of elective C-section. So an elective C-section, as you know, is a C-section that occurs before the onset of labor and the rupture of membranes. As with any surgery, a C-section poses risks for women, and particularly in settings that lack the facilities or capacities to conduct safe surgery or treat surgical complications properly, or where access to labor care or repeat C-section in subsequent pregnancies cannot be taken for granted. So the World Health Organization recommends avoiding unnecessary C-sections for all women. And based on the result from a systematic review to assess maternal and perinatal outcomes, comparing elective C-section with other modes of delivery for women living with HIV, the evidence suggests that routine elective C-section for all women may not be appropriate. However, the risks and benefits will differ across settings. And depending on underlying risks of complications from C-section and the underlying risks of vertical transmission during delivery, and individual patients and clinicians, therefore, should consider the risks and benefits for all women, including women living with HIV. Next slide, please. So this slide outlines new recommendations with regards to the provision of medical and surgical abortion to women living with HIV. And comprehensive sexual and reproductive health and rights includes, but is not limited to, providing comprehensive sexuality education, access to contraception, safe abortion services, and treatment of complications when abortions happen unsafely. And this guideline explores the question of clinical care for women living with HIV and addresses the question of whether women living with HIV are at greater risk of adverse abortion outcomes compared to HIV uninfected women. And the existing evidence from a systematic review shows that both medical and surgical abortion are safe and effective for women living with HIV. So healthcare providers should not therefore be deterred from providing access to safe abortion to their patients living with HIV. This is also in line with current WHO safe abortion guidelines that are shown on this slide. Women living with HIV, therefore, should be offered a choice of options that is free from coercion. And another important aspect of this guideline is to improve self-efficacy and self-empowerment of women living with HIV. And this includes, for instance, enabling regulatory environment that can help ensure the additional legal challenges that are faced by women living with HIV can be reduced. So the issue of self-efficacy and self-empowerment will be discussed further by the next presenter. But together, this guidance supports a comprehensive approach to sexual and reproductive health and rights. Okay. Next slide, please. So the framework that I mentioned supports, as I said, recommendations, but also good practice statements. And we recognize that many excellent initiatives and programs and policies already exist in the region. And in implementing these global recommendations and the good practice statements, countries can adapt them to the local needs, the local context, and build upon their national best practices. Next slide, please. So in conclusion, an integrated approach to health, human rights, and gender equality lies at the heart of ensuring the dignity and well-being of women living with HIV. And action on the recommendations in this guideline therefore requires a strategy that is not only informed by evidence and appropriate to the local context, but it also must be responsive to the needs and the rights of women living with HIV. This guideline also includes discussion of implementation issues that managers of health interventions and service delivery must address to achieve better health outcomes for women living with HIV. I look forward to receiving feedback on how best to implement this guideline in your country, in your region, so that we can overcome barriers to service uptake, use, and continued engagement, so that we can reduce stigma, we can reduce violence, and deliver the highest quality of care. Thank you. We will move on to Martha Falana presentation, and as I mentioned earlier, we will go through all the presentations and then come back for questions at the end. Thank you.
Yeah, good afternoon, everyone. Thank you for having me on this webinar. I'm going to talk about the importance of community engagement in the development of the guideline, which has been something very important to us as women living with HIV. Next slide, please. The development of the guideline in terms of its engagement of the community as women living with HIV, it has been a groundbreaking milestone for women living with HIV, as we carried out a survey of women living with HIV, and this has been the largest ever that we have done among that has been done among women living with HIV. And for us, the importance of capturing the stories and lived experiences and putting them, translating them into the data that are building the evidence for development of the guideline. Next slide, please. The process and realization of the guideline in itself is an empowering tool for us as women living with HIV, as we live it, experience it, and have to be partners throughout the continuum of care, starting at the level of developing the guideline. And when we look at the recommendation on self-efficacy and empowerment of women living with HIV, we can see that around a whole range of our well-being that includes physical, emotional, mental, reproductive, and sexual health, and all the components addressing all diversities in all contexts are essential. Next slide, please. We have this house that shows the self-efficacy and empowerment within SRHR. This is our house, which is our safe house, which is on firm ground, and that means the needs and rights of all women in all their diversity are addressed. And this has a whole lot looking at sex life, pregnancy, fertility, treatment side effects, financial security, mental health, our human rights, gender equality and social justice, meaningful involvement of women living with HIV, protective laws, and importantly, respect for all our diversities and support and safety in healthcare, at home, and in the community. And when we talk of all women, we are including heterosexual, lesbian, bisexual, transgender, intersex women. We include women who use or have used drugs, women who are or have been involved in sex work, women who are single, married, or in stable relationships, women who are separated, divorced, or widowed, women who are sexually active and those who are not sexually active, women and girls who have undergone female genital mutilation, women who are contemplating or have had an abortion, women who are indigenous, women living with disabilities, women and girls who have TB, malaria, hepatitis B or C, and or other comorbidities and non-communicable diseases. Women and girls who are currently or have previously been incarcerated, detained, or homeless, women and girls who are economic or political migrants, and adolescent girls who have acquired HIV perinatally in childhood or during adolescence. And we want to make sure that when we talk of this guideline and in the service provision and realization of our rights, we are including all women and girls. Next slide, please. When we are looking ahead, and we are excited about this guideline, and that is the guideline. It carries our voices and those of partners, and we look forward to continued engagement and involvement by countries in disseminating the guideline to all concerned, and our continued partnership in ensuring implementation of the guideline. And we also look forward to the process being followed of followed of meaningful community in this guideline now being taken up by the WHO for other and future guideline processes. This is the only way in terms of meaningful community engagement, the only way to increase uptake and buy-in from those the guidelines are designed for. We are committed to continuously giving feedback on the implementation and the impacts on our well-being. And in all, as we want to emphasize that in all SRHR services, language should be inclusive of all the diversities that I mentioned, that are amongst other diversities, because we are a very diverse community as women, and we do not want anyone to be left behind. That is the end of my presentation. Thank you very much.
Thank you very much for the opportunity to share my thoughts with you about these guidelines that I had the great privilege of being able to be part of. Next slide, please. I will take a few minutes just to share my thoughts on these guidelines from the perspective of a researcher and also from the perspective of a healthcare provider. Next slide. For me, the face of HIV still remains a young African woman. A young African woman who was my age when I first encountered HIV, and now has the face of a young woman who could possibly be my daughter. My hope is that HIV will not bear the face of a young lady who could be my granddaughter even as I grow older. But before we are able to completely stop new infections, it is really important for me that we must improve the lives of those who live with HIV and ensure that they live their lives to the fullest possible opportunity, which includes paying attention to their sexual and reproductive health and rights. Next slide. As a researcher, these guidelines point me to where we still need to do a lot of work. When you look through the guidelines, you will realize that there are many sections where the guidelines indicate evidence may be indirect, may be moderate, may be weak, or may be classified as low quality. As a researcher, this tells me that there really is a need for us to examine these areas and, using appropriate methodology, be able to improve the evidence that is needed when we need to revise these guidelines or need to do more work on them. There is a lot that needs to be done. We need high quality, good evidence that informs us of the decisions that we need to make. Next slide. I wear another hat that says a healthcare provider. And what comes to my mind from a healthcare provider perspective is this. What do we need to do? What kind of tools do we need in order to implement these guidelines that have been provided? And I've given a few examples of some of the things that I was thinking about as I looked through these guidelines. The BSc, for example, what should we include in this communication? What kind of information do we provide? We need to provide comprehensive information, brief enough to allow someone to look at them and understand them. Yet we must avoid opportunities for blame, and we must ensure that we do not stigmatize anyone. When we counsel adolescents, what kind of tools do we use? Are we thinking paper? Or in this age when everyone's electronic, and especially adolescents, what kind of tools can we use that allow them to be able to safely disclose in a manner that allows them to get support, but also avoids them being marginalized or stigmatized? My biggest challenge, however, as a healthcare provider is thinking about the healthcare workers, their attitudes, beliefs, and their values. In the overworked, often understaffed, and sadly, not very well remunerated public healthcare sector. In my country, in Kenya, we have had so many healthcare worker strikes, even one that is ongoing right now with the nurses, who are the majority of our healthcare providers. How do we ensure that this healthcare sector, what kind of tools do we provide them with? What kind of training that can help them ensure that they can improve the output of their work, have worker satisfaction, but be able to really give good service provision? What tools do we use? How do we ensure we can train them? Because our ultimate goal is to ensure that individuals who are living with HIV, particularly women, and with regards to their sexual and reproductive health and rights, they receive the highest support to get the healthcare services that they need. Last slide. My hope is that this young girl will be HIV-free. If for any reason she is not the baby that is being carried, that we will give her an opportunity to live her life to the fullest if she is living with the virus, and enable her to achieve her highest potential. Thank you.
Good afternoon. Caroline Carey, and I am from Zambia, and I wish to thank the WHO team for allowing me the opportunity to join this webinar. I'm going to address the perspectives from the Ministry of Health and implementing best practices at policy level. Next slide, please. So looking at the new recommendations, especially in the new guidelines that have been developed for sexual reproductive health and rights for women living with HIV. Have the next slide, please. Basically, I'm going to address what is it that the country needs to do in order to be able to implement this. What is the country's perspective? What is it that they have to address in terms of being able to ensure that these guidelines which we get do not just sit on the shelf, but as countries, we're able to implement them and we make a difference for provision of services of women living with HIV and AIDS. One of the things that we're addressing is basically what are the the legal framework and the national guidelines that are already existing in the countries. And the best way of doing this is basically being able to engage with the various stakeholders. And here, when you look at the recommendations which were mentioned earlier, you notice that some of them are actually across sectors. And here we're looking at the different stakeholders like the technical working groups. We also need to engage the technical working groups which are addressing gender-based violence, and also working with the professional bodies, because I've noted that in my work as in the ministry that if you do not engage the clinicians, especially the frontliners, the physicians and the gynecologists, you find that most of these guidelines are not really accepted by the country and they are not adapted into the national guidelines. So this has to be done. Next slide. I'll look at the next slide. Yes. So Furthermore, the other area that we need to engage, because when you look at the legal framework, this is where we have to work with the parliamentarians, especially if you look at some of the recommendations which border on adolescents and whether they can be able to receive the services as well as the information. We also look at any and try and ensure that we review these and incorporate the recommendations in the existing policies, guidelines, and training materials. Can I have the next slide, please? So, as I had mentioned, that on multi-stakeholder engagement, one of the things that we did in the country, in Zambia, when we did get some of these recommendations at one of the AFRO meetings that we had, we basically shared the revised national guidelines with all the stakeholders. We ensured that any programs that are being implemented with the partners, they implement the new recommendations. We also engage National AIDS Council to ensure that we disseminate some of these recommendations and working with the networks that the National AIDS Council already has with people living with HIV and AIDS. And most importantly, working with the civil society, partnering with the civil society to be able to ensure that the guidelines are disseminated to a wider audience, because they have the CBOs and the faith-based organizations which we can work through on the ground. Could I have the next slide, please? Furthermore, addressing the issue of scaling up and how we ensure that the countries can be able to adapt these recommendations and the guidelines is the issue of capacity building. We have noted that when we get new guidelines in the country, it is not always that they actually reach the frontliners, the key healthcare providers, those who are providing the services in the community. This can only be done if there's orientation. And then we also ensure that there's proper, we strengthen the infrastructure where we are able to provide the services. It is good that the recommendations are mentioned, especially on strengthening integrated services for HIV and sexual reproductive health and rights services. However, if the infrastructure is not adequate, if the government doesn't invest in the infrastructure, providing that the health facilities, even the all areas where the services will be provided have integrated services, this will not work. So that has to be supported as well. We also need to build capacity in terms of pre-service. And here I'm looking at the recommendation on cesarean sections and the abortions, which was mentioned earlier. If this is not put in the pre-service curricula and the training of the health workers who are actually going on the ground to provide these services, if this is not done, then then it will not be incorporated. We're still going on with business as usual. Therefore, what we do is ensure that we incorporate these new guidelines into the curriculum and into the training for pre-service. Could I have the next slide, please? Maybe I could go on to mention in the next slide, we also look at the services that are being provided and what bottlenecks we actually encounter when we're implementing these recommendations. Some of the bottlenecks, as I mentioned, is basically on the existing country legal framework. This can affect how you implement. And for sexual reproductive health and rights, especially for the adolescent girls, if you do not address working with the parliamentarians, as I said, this can actually be a bottleneck. Other bottlenecks we've encountered is basically the cost of implementing recommendations. The different ministries, you noted like in Zambia, we have gender-based violence being managed in the gender ministry. We'll look at provision of health services, especially for the adolescent girls, is addressed in two different ministries. This is the Ministry of Health and the Ministry of Education. So if these are not well coordinated, if they don't work together, and this should be done through this, the sector advisory groups, the health sector technical working groups, you'll be able to provide, you would avoid duplication and be able to ensure that the cost of implementing these recommendations is reduced. The other area is basically the cost of reorienting frontline health workers, especially those who are already working. So this can be done through the systems that are existing, and that can be a cost if it is not well managed. And I have the last slide, please. We'll go to the last slide, and basically it's just a recommendation that for us to be able to implement these stakeholders, we need to be able to have what best practices have we got on the ground. So we'll look at the multi-stakeholder platforms which have been created. Here we discuss the age of consent for the adolescents. We also discuss with parliamentarians. We engage the parliamentarians where they actually have an SRH and HIV integration committee in place. And this is chaired at the highest level by the Secretariat, which is at the National Assembly. Once we work with these, we have seen that we actually are able to perform better. It is also expected that the key recommendations for these guidelines should be included within the national policy. That's what we have done for some of our guidelines. I think that's the last slide. So I wish to thank you for the opportunity to be able to share what we're doing in Zambia. Thank you.
So thank you very much. And my name is James Carey. I'm working with Manjula here in WHO. And it's really a pleasure for me to just briefly talk about some of the next steps for the guideline dissemination and implementation. And as somebody who has worked for many years, both as a sexual reproductive health provider, as a teacher and also a researcher in Africa, I have realized that it's very important not only to have the guidance documents, but really to ensure that they do cause change on the ground in terms of what we are doing. And it's, I think from the presentations from the previous presenters, we know what change that we want to bring. We want to implement the recommendations and also the good practices that are contained in the guidelines. The woman-centered approach and the community engagement that was adapted for this guideline development, I think is one of the best foundations and starting points for getting this to get out of there. And I believe with this continued engagement that Martha referred to, we'll be able to get this off in the countries. However, I think it's very important for us to really understand behavior change, and that knowledge on its own is just the beginning to change what providers are doing or what communities are practicing. We need to understand that there are many more barriers that we'll need to overcome before providers stop doing cesarean section routinely, before the best practices are adopted in terms of prevention of violence against women and so on. And for this webinar, it's good that we've had Elizabeth, who is a provider, a researcher, an academician that I've known for quite a long time. We have had Martha give us the perspective from the community, and also Caroline, who has given their perspective as a program manager and a policy maker. And for us, looking at the next steps in terms of the dissemination of this guideline and its implementation, we are going to look at keeping all those communities that have been participating, represented by the presenters today, engaged and contributing to this process. So this is just the first of several regional webinars that we are going to do in all the regions. And this is really targeting to basically create awareness of the guidance and have knowledge that this is something that is coming, and also to encourage all of you who are participating to share this with your various stakeholders. Our next important step is that we are going to work with the communities that we have been engaged with the Ministries of Health, with the academicians and providers in specific countries to see and to learn how we can get this implemented. And following that, then we are going to learn from that process and share some of those lessons so that other countries can get this implemented And what is important is that we not only implement this in small-scale pilot projects, but we actually get it scaled up on a large scale countrywide. There are various challenges that we need to understand as we go into this in terms of context. Some of the facilities we'll be working on already have very high cesarean section rates for women, not just in relation to unnecessary cesarean section for women living with HIV, but generally unnecessary cesarean section being done with inadequate indication. So that is something that we will need to overcome. We've had the challenges in terms of empowerment, and Martha referred to this in terms of that it's very important for us to be very inclusive in all that in all the approaches that we have. So in a nutshell, those are some of the next steps that we are thinking and will be coming to you to work with you to be part of the process that will see us not only have the guidelines, but really get them used and implemented, and to see them change the practice and see that these guidelines actually do benefit the women that we are all working for. Thank you.
Françoise, please go ahead.
Yeah. Okay, thank you very much. In addition to what James said in terms of next steps in AFRO region, we are planning a number of activities from September to December 2017. We will be organizing other webinars for Francophone and for Lusophone countries. We'll also use different opportunities of regional workshops, including the upcoming sexual and transmitted infection regional workshop and community consultation workshop planned in November to disseminate those guidelines. We are also planning a session during the International Conference on AIDS and Sexual STIs in African region planned in December in Abidjan. This December we have a session on the dissemination of these guidelines. For the next year, we are also planning a number of activities, but the focus will be in-country dissemination, adaptation, and adoption. We are encouraging countries to see how to go for that in collaboration with different partners who were involved in the development of those guidelines. For example, UNAIDS, UNFPA, UNCHR in some countries, but also community, women living with HIV, civil society organization. We need to engage from the beginning all those partners in the adaptation, but also for the implementation process. WHO and other partners will be providing support, technical support to countries in that process, but also in the implementation process. As you know, our region is the most affected by HIV. We have the high burden of HIV, and we have more than 13 million of women living with HIV in AFRO region. So we hope that these guidelines will be are welcome and will be with a high interest in our countries. As we said, the first audience of these guidelines are frontline health worker providers, program managers, and Ministry of Health managers, and National AIDS Program Control managers. And we need to make sure that we are engaging all stakeholders, including other ministries. We have been discussing here that community are important, but also we need to engage politician or parliament if there are some legal implications. And the approach will be next slide, please. The approach, as we discussed here, will be women-centered, gender-sensitive approach, addressing the sexual and reproductive and human rights needs, aspiration and rights for women living with HIV, starting from adolescent period to women aging, including menopause issues. We need to make sure that our approach is changing, is more people-centered, and is meeting more the aspiration of women living with HIV. Next slide. As we have discussed here, the multi-sectoral approach is very important. We need to make sure that we are engaging other ministries, for example, the education, gender, Minister of Social Affairs. We need to make sure that we have a participative approach, and we are using the comparative advantage of different ministries who may consider to include in the policy and the program. As we said, we need to make sure that stigma, discrimination were addressed in by different stakeholders. And to finish, I want to recall that the dissemination, next step please, the dissemination is for all settings. We are not considering the HIV burden. The guidelines are relevant to all settings, regardless of the situation of HIV burden and epidemic. This is for generalized settings, concentrated epidemic, high and low burden HIV epidemic. They are relevant for all economic contexts, and they can be adapted to national context. We know that the previous guidelines were released in 2006. Now it has been a lot of change in countries, a lot of experience. So we need to build on that, taking in account different contexts, but also addressing national specific bottlenecks to implementation. We hope really everyone will be interested to update the national programs, policy, and plans, and to consider those guidelines as a key step in the development of HIV and also for women's health and adolescent health. Last slide, please. So we are very happy to be part of this global movement of human rights for women living with HIV to address sexual and reproductive issues related to HIV. Last slide. Let's work together, and thank you very much for your involvement. Thank you, Caroline, to show very clear the country perspective. Thank you, Martha, for this community engagement, which will go beyond the development of the guidelines. Thank you, everyone, for AFRO opportunity to be part of this dissemination. Thank you very much.
Thank you all very, very much. I think to all the panelists for their excellent presentations. I think you can appreciate that putting in place a guideline like this and making it relevant and making an impact in the lives of the women living with HIV, but also for healthcare settings, for the healthcare providers, to make a change and make a meaningful, positive change requires that many people and many perspectives and many cadre of workers and this multisectoral approach that almost every panelist talked about is going to be absolutely critical. And we often talk about it, but we often are challenged about how we operationalize something of that nature. So we are really hoping, and as James mentioned in his presentation, what we're really hoping to do is to work at country level and to work with many of you to hear from the national and the regional stakeholders about what works at countries, what would be the most useful for you in terms of tools. Is it infographics? Is it a policy brief? You know, what will make the change? We're really hoping to hear from you on these aspects, and then develop something that is relevant to the local context. Okay, I know that we do not have much time, but as I mentioned, when if you have questions that we're not able to answer now, we will get back to you with some responses, and the webinar will be available online. So please do share it. Here's the information on our website. We will have everything posted. James also mentioned that we will be doing webinars for other regions. We have done one already for 3 of the other regions, and we will have another one in French for the African region. So do refer to this and share it with your colleagues. If there is a question, please go ahead and type it on the right-hand side of your panel, and we may have time for 1 or 2 questions. Are there any comments from any of the panelists as well? Please feel free to. I'm hearing something, but
there is a question, Mandela.
There's a question from Amandine. Yes. Go ahead. Go ahead. Adis, did you want to unmute, Amandine, or? Could you type in your question on the right-hand side of the panel? Adas, are you able to see the question? Because I'm not able to see it. Okay. I would suggest, given that we have 1 minute still left, I would suggest that those of you who have questions, please send them directly to me, or to Adas, and we will certainly get back to you with responses. And thank you all very, very much for your time, for your engagement, and we really look forward to working with all of you and taking this forward. Thank you.
Yes.
Thank you.
Thank you. Bye-bye.
Thank you.
Thank you. Bye.
Thank you. Bye-bye.